A 79-year-old woman with type 2 diabetes mellitus and hypertension undergoes 99 technetium cardiac scintigraphy for the evaluation of 3-month history of retrosternal chest pain. She's having retrosternal chest pain on exertion. That is important. Exertion is important. The patient's symptoms are reproduced following the administration of dipyridamole. Reproduced from the administration following the administration of dipyridamole. Repeat ECG shows new ST depression and T wave inversion in leads V5 to V6. Which of the following mechanism of action of this patient's signs and symptoms during the procedure? So you have to know the mechanism of action of dipyridamole, which is used in cardiac stress testing. The following is the underlying mechanism of this patient's signs and symptoms during the procedure. What procedure? The patient is given dipyridamole. What is dipyridamole again? Dipyridamole and silastazole are the drugs used in claudication. Okay, claudication. It is used in stroke 2. It is used in claudication. What is the mechanism of action again? If you can recall, it increases adenosine. It increases adenosine. What is adenosine? What is the mechanism of action of adenosine? It is a vasodilator. Okay, it is a vasodilator and it increases adenosine. Now, dipyridamole also causes increase in cyclic AMP because it is a phosphodiesterase inhibitor. You know how phosphodiesterase work? So cyclic AMP, which is formed, should be degraded by phosphodiesterase, okay, into degradation products. Now, if you inhibit this will increase, right? So cyclic AMP, if it is increased, it causes smooth muscle relaxation. This is why dipyridamole causes smooth muscle relaxation in the vessels. If it is relaxing, it causes vasodilation. Okay, this is how dipyridamole works. So now we know we have to know the mechanism of the drug already. So it causes dilation of coronary vasculature, right? Now, why is it used in cardiac stress testing? What the question tells is the patient is already having chest pain on exertion. So I think he's having stable angina. Now he's given dipyridamole, and now he's having new ST depression and T wave inversion. So there is some kind of ischemia happening after giving dipyridamole. This is called pharmacological testing. Okay. Now, why is this happening? So what happens in coronary? This is called coronary steal syndrome. What happens is if someone has coronary stenosis, so there is stenosis of coronary vessel. That is why he's having all this retrosternal chest pain and exertion. So what happens is the heart inherently it tries to dilate the distal part, because this part of the heart is not getting blood. So what it thinks is, I will dilate this part of the vessel and I will increase the blood flow. Okay, this is what the normal heart does. Now, when you give dipyridamole, what happens is this dilates all the coronary vessels irrespective of the stenosis. So it tries to dilate this also. It tries to dilate whatever coronary vessel is there, some other side. It tries to dilate everything. When it tries to dilate everything, what happens is the blood which was going to the stenosed part goes to the normal part. Okay, now good vessels is also getting more blood. The stenosed part which was getting blood is not getting blood right now. Now it causes ischemia. Now that's why the patient is having new ischemic features, that is new ST segment, ST depression and T wave inversion. Dipyridamole increases adenosine, which in turn causes coronary dilation. We know that by activation of adenosine receptors. Coronary steal syndrome is myocardial ischemia due to redistribution of blood flow, right? The rigidity of severely stenotic arteries allow only a low coronary flow reversely. But when the coronary artery dilates, blood is therefore diverted to the healthier vessels and collaterals. This leads to tissue ischemia distal to the stenosis in the coronary artery, which manifests as chest tightness and new ECG changes. This phenomena is called coronary steal syndrome. This is the underlying principle of cardiac stress testing. Okay. Now, why is the other options wrong? We'll go through it fastly. Vasospasm of coronary arteries is transmetal angina, right? So even if we give dipyridamole, there should be vasodilation of coronary vasculature. And transient AV nodal block, what is it? You have to read about the types of block. Type 1 block, type 2 block, type C block. If someone has AV block, they will have bradycardia because the atria is not able to send message to the ventricle. Now, reduced left ventricular preload. Where do you see reduced left ventricular preload? When there is decreased preload because of vasodilation in the veins. This is possible by nitroglycerin. Okay. Now, ruptured cholesterol plaque within the coronary vessels. This is unstable angina, right? There is thromboembolic event going on.
Thanks for watching. Please give a thumbs up and subscribe for more.